Hi guys, Dr. Luster here, and continuing our conversation on diabetes and insulin and blood sugar and fasting, we're actually going to talk a little bit about what kind of diet is appropriate for these kinds of things. So it's a little bit different for blood sugar management versus full-on diabetes, but for the most part the rules are the same. And of course I want to put in the caveat that all diets are really vary per person, and it is crazy to me that we think that it's really a one size fits all. Like, there are vegetarians that are perfectly healthy as vegetarians. There are people who only eat meat who are perfectly healthy at only eating meat. And I think it has a lot to do with like where we come from and where our genetics was from to what the appropriate balance would be like. There are some finite rules for sure where your body needs a certain balance of proteins and minerals and vitamins and all of these things, but you can get them from all sorts of sources, and it just seems crazy to me. Like, there's a reason why all of these diets are successful, and then why all of them have flaws, so it is not a one size fits all. So definitely talk to your provider, make sure that they know what they're talking about, and just have that conversation about what is right for you. So in terms of what does a healthy blood sugar management diet look like, these are general guidelines to manage that, but with the caveat of this is definitely something that you shouldn't take lightly, because blood sugar management is a super important thing, and mismanaging it can have very profound consequences. So there are a lot of things where it's like high carb. Should it be high carb? Should it be low carb? Should it be no sugar? Should it be artificial diet everything? Should it be no meat? All of these different types of things. So as a general rule, I don't care about that. What I care about is that you eat regularly, especially when you're taking your medication. You have to eat when you take your medication, okay? So I care that you eat regularly because it is important to maintain a balanced blood sugar. So you have to eat regularly, and whether it's little meals all of the time, like grazing, whether you're a grazer or whether you're a meals person, I don't care. Just eat regularly, and especially around your medication. The second part of it is eating something that is substantial. Now, when I say substantial, I actually mean it's got fats and proteins in it. I don't care if those fats or proteins are from vegetables or from meats, but you have to have them in it because they are what's going to balance your blood sugar more than anything else. So it has to be fat and protein heavy, and you can have carbs, but I would definitely try and limit them a little bit to more complex carbs. But like I said, I'm not saying you can't have some of the starches that things come with. Like, you can't have the rice with it, or you can't have the mac and cheese. I'm not saying that those are great options, but I am saying that if you had a tiny portion of those things and a huge steak with it or whatever else, then you're gonna be fine. Like, that is a much more balanced meal, and it's much more appropriate. So balancing your meals with lots of fats and proteins, wherever that source is from, is going to be the key there. The other part of that, I would really stay away from liquid sugars. So that tends to be most people's problem with sugar intake, is one of two things, I guess. Some of it's candy and sweets and stuff like that, but also juices and sodas, and I would throw alcohol in there too. Those are huge, have huge impacts on your blood sugar, and we take in so much more sugar through drinking it than you would ever imagine eating. So really limiting that is going to help a long way. Choose water. I know it's not always the best. Put some fruit in it or something, but choose better options for that specifically, and you'll make a big impact. I also would highly recommend that you eat first thing in the morning. This is going to break that fast that you had all night, which is really important because now you're about to kickstart your day and do all of this exercise and stuff like that, and it really helps your brain regulate better and manage your cortisol better if you have a input of sugar in the morning, and then it slowly decreases throughout the day. So I would definitely eat first thing in the morning, especially if that's when you're taking your meds. And the last part of it is going to be to really avoid these artificial sugar things. So a lot of diabetes stuff and blood sugar management stuff is aimed at artificial sugars, all of these diet products, right? But artificial sugars, they're really bad for your body. We have a whole video talking about artificial sugars, but artificial sugars basically trick your brain into thinking that you're actually getting sugar, but then there's no sugar in your bloodstream. So your brain's like, there's gotta be sugar. Like, the body told me that there's sugar. You know, the taste buds, I got that there's something sweet. So you should be finding sugar in the bloodstream. And the pancreas and all the cells are like, dude, there's no sugar here. They're like, I don't know what to tell you. Like, one of you's lying, you know? So you have to, it's so much better to eat the actual sugar so your body doesn't think that your brain doesn't think that your body is lying, and start shutting things down. So eat the actual sugar so your body at least knows what to do with it. And I promise you that you will actually start managing it a little bit better, because you're going to feel the effects of some of that too much sugar. So staying away from artificial sugars is huge. Last part of that with the artificial sugars, it also destroys a lot of your brain integrity and causes an exacerbation of a lot of the problems that you think are diabetes related, but are actually because of the poor blood sugar, because of the poor eating habits with the artificial sugars. They're really bad for you guys. I hope that helps. If you have any questions, please link them in the comments, and we will talk later. Thanks, guys.